So now we come back to heart disease, to cardiology. Our next speaker is Robert Ostfeld, who is a cardiologist and the founder and director of the Cardiac Wellness Program at Montefiore. He's an associate professor of clinical medicine at the Albert Einstein College of Medicine, and he's the associate director of cardiology fellowship at the Montefiore Einstein. Dr. Ostfeld earned his BA from the University of Pennsylvania, graduating summa cum laude and Phi Beta Kappa. His MD is from Yale University of Medicine, School of Medicine. His Master's of Science in Epidemiology is from the Harvard School of Public Health. Did I tell you? You know, this guy's got some cred. And Dr. Ostfeld completed his medical internship and residency at the Massachusetts General Hospital and his cardiology fellowship and research fellowship in preventive medicine at Brigham and Women's Hospital, both teaching hospitals of Harvard Medical School. His professional interests include cardiovascular disease prevention, medical education, and clinical research. He earned the Outstanding Full-Time Attending of the Year Award at Montefiore for excellence in teaching medical residents, the program's Director's Award for dedicated service on behalf of the Montefiore Einstein Cardiology Fellowship, and was elected to the Leo M. Davidoff Society at Einstein for outstanding achievement in the teaching of medical students. And Dr. Esselstyn was telling me that he spoke at Einstein at one point, and a young cardiologist came forward, and you know, this guy who's hardworking, extremely intelligent, has the best schooling and so on, and said, was a little frustrated that what can I do more for my patients? And he was really taken by Dr. Esselstyn's presentation. Dr. Esselstyn said, hey, come to Cleveland, come stay with Ann and me, and I'm going to be putting on a program. And so he went out and he took the program, and he did more than take the program. He took over the program, his own program, in New York, where he now has a really successful clinic doing this and educating people. It's an honor and a privilege to have him. Please welcome Dr. Ostfeld.
Can you all hear me back there? Jeff, thank you for that incredibly generous introduction, and it's an absolute honor to be with you all here today with VegSource and the Healthy Lifestyle Expo. So Jeff asked me to touch a little bit on the cholesterol measures that you were all getting earlier today. So I'm a cardiologist, and lots of years of schooling and lots of nights on call and reading all sorts of guidelines and things like that. So in that milieu, I basically like to think of cholesterol like a game of limbo. How low can you go? There is nearly a direct linear relationship between increasing LDL bad cholesterol levels and increasing heart disease risk. And actually, Dr. Clapper and I were speaking earlier, and we both felt that our whole notion of normal here in the US is totally skewed because it's based on a Western population. Now, when we're born, when we're neonates, our LDL cholesterol levels are around 30 to 70. And if you look at our animal kingdom cousins, the monkeys, the baboons, their adult LDL levels are about 80. But we munch our ways up to around 130 or higher. So I think our whole notion of normal is completely skewed because we're basing it on a Western population. And there are a lot of cardiology guidelines about lipid levels, and they actually kind of put targets to the side a bit. But as a rule of thumb, I generally like to see for a fasting cholesterol level, ideally my patients would have a total cholesterol less than 150, and an LDL bad cholesterol level, ideally less than 70 to 80. So those would be amazing goals. So today we are going to speak about your heart on plants. So a little bit of background. I've been interested in health for a long time. When I was a kid, when I was 7, I had a younger brother named Daniel who died from an incurable disease. He was 3. So ever since then, I've been moving in a direction towards health and prevention. And so one thing led to another, and I became a cardiologist. And I didn't learn, I trained at some pretty mainstream places, but I didn't learn about a plant-based diet there. And when I came down to Montefiore to work, I did all the things that I was trained to do, guideline-based medications, maybe a Mediterranean-style diet. And perhaps we slowed the pace of disease a bit, but we really weren't preventing and reversing things. And I was starting to get disillusioned. I'm like, what am I doing? And it was right around that time that I stumbled across the amazing book, The China Study, by Drs. Campbell, which highlights, of course, the benefits of a plant-based diet on health. And then one thing led to another, and I started a cardiac wellness program at Montefiore with the goal of preventing and reversing disease with a whole food plant-based diet. And I say disease, not heart disease, because as all of you know, eating this way, yeah, it's good for your heart, but it's good for you for thousands of other reasons. So our goal is to prevent and reverse disease. And quite frankly, I've been a cardiologist now for about 11 years. And outside of emergency surgery, I have never seen anything come close to the breadth and depth of benefits that eating this way provides. So I'd like to, again, say thank you to all of you for spending time here at this amazing conference and with me here this afternoon. Some themes to think about are, I'd like each of you to make one or two specific goals. Maybe you want to lose a little weight, maybe you want to come off a medication, maybe you have a reunion coming up and you want your skin complexion to look a little better, whatever that might be. But think of it now, and then think about the things that we're going to talk about and how that can be woven into your goals. And then when you go home, start to make it happen. So I'd like to also give a couple of patient examples that I think are pretty powerful. There's this one lady I saw. She's in her late 60s, and she had had a heart attack. And she was at another hospital, and they recommended bypass surgery for her. And it was, a very evidence-driven decision, a very sane decision that they recommended to her. But she said, I don't want any procedures. And so she went on medications and, didn't have bypass surgery. And she somehow found our wellness program. And so she was already on all the good medications. So when I first saw her, she could literally only walk about almost a block, and she would have to stop because of shortness of breath because of all the cholesterol blockages in her heart. So we flipped around her lifestyle. Fast forward 4 months, she lost about 15, 20 pounds. Her LDL cholesterol fell another 70 points, and she is walking for 30 to 40 minutes on a treadmill. It's awesome. But it got kind of weird. So I'm talking to her on the phone, and it's a little evasive, and it seems like she's not getting better, and I'm not quite sure what's going on. And then 3 or 4 weeks later, I get this call from yet another hospital, and she was admitted with chest pain, and she was about to have bypass surgery. I'm like, what's the story? So I later learned that there was a major rift in the family. Half of the family thought the whole food plant-based diet was great. And the other half of the family thought it was the opposite of great. And she was living with the half of the family who thought it was great, and she was eating and living that way as she was getting better. And then she moved to live with the half of the family who thought it was the opposite of great. She went back to her old habits, and over the course of 4 to 6 weeks, decompensated and had bypass surgery. And I thought that one example just shows how powerful this intervention can be and how quickly it can take effect. And one other pretty cool example I wanted to mention is this one patient of mine. He's in his late 50s, and he has a family history of heart disease, and he understandably very much wanted to avoid that. And so, he would exercise. He loved badminton, loved it. He would play badminton 2 or 3 hours a day. But he started to get this tightness in his neck. And it would come on earlier and earlier till it would happen even 30 or 60 seconds after he would start to exercise. And so he saw a doc, and they did a stress test where they look at whether there may be poor blood flow to the heart muscle. And his test was so wildly abnormal that they sent him directly to the hospital. Directly. Don't go home. Don't go to Go, Monopoly. Don't pass Go. Go straight to the hospital where they did a cardiac catheterization. And his anatomy, the blockages in his heart, were so severe That, again, don't pass go, don't go home. They sent him straight to the hospital to be admitted to wait for bypass surgery. It was that severe. And so he's, in the hospital waiting to have bypass surgery. And it's kind of boring in the hospital. And so, he goes online and he reads about the plant-based diet. And he's like, that's a better way. That's what I want to do. And so, not that I'm recommending anybody do this, but he then signed himself out of the hospital against medical advice. And the nurse who was taking care of him begged him to not leave, begged him, called his wife at home, begging her to have him stay. When he left and went home, called him at home, begging him to come back. But he decided not to, and he found our clinic. And in one of the most remarkable turnarounds I have ever seen, in 1 week, he went from being able to walk 1 block to 25. And then in 3 or 4 months, he's back to playing badminton 2 or 3 hours a day. All he did was change his lifestyle. Incredibly powerful stuff. And that nurse, I brought her up because unfortunately, a few weeks later, she was diagnosed with heart disease. And the doctors there told her that she needed a cardiac procedure. And she said, you know what? No way. She called up that patient. She's like, what did you do? I'm doing that. Oh, yes. So I need to give a very special thank you to Dr. Caldwell Esselstyn and the Esselstyn family. They've been incredible mentors and friends. And they have been instrumental every step of the way of the growth and development of our wellness program. It's been phenomenal, so thank you. So this is what we're going to talk about today. We are going to talk about how common is heart disease, what is the cause, how can we prevent and reverse disease, what are we doing at Montefiore, and then we're going to go beyond the heart. So I need a little audience participation. So what percentage of 12 to 14-year-olds in the US do y'all think have early signs of cholesterol disease in the blood vessels that feed their hearts with blood? Wow. I think I heard between 35 and 90. So that's very good. You guys are absolutely right. It is indeed between 35 and 90, but you're much more specific than the medical students I teach, because usually I get somewhere with them between 0 and 100%, but they're like expert test takers, So it's 2/3. About 65% of 12 to 14-year-olds in the Western world have early signs of cholesterol disease in the blood vessels that feed their hearts with blood. And we know that from pathology studies of kids who died from other reasons. So the next time you go to a bar mitzvah, 2 out of 3 of those kids running around are going to have cholesterol disease in their heart. But you don't have to worry, because it gets worse. So about 1 million heart attacks or so happened in 2001, and it's fairly similar now. So that's 2 heart attacks every minute. 2 heart attacks a minute. So we've been speaking now maybe for about 10 minutes. That's 20 heart attacks. 20 heart attacks have happened in the US in the 10 minutes that we have been speaking. And heart disease, of course, is the #1 killer of adult men and adult women. And women are about 6 to 7 times more likely to die from heart and blood vessel disease than they are from breast cancer. So clearly you don't want either one, but it highlights the epidemiologic importance of prevention of heart disease. And scarily, about half of heart attacks happen in people with, quote, normal cholesterol levels. So in a country where it is normal to die from heart disease, I think normal is anything but normal. Oh yes, a day in the life. So I thought, I'm coming, I work in the Bronx, I work at Montefiore in the Bronx, and I should say I feel really honored and privileged to work there. That hospital has an incredible social mission, and they serve often a largely underserved population, and they take that mission to heart. So it's a real pleasure for me to be a part of that. But I thought, I'm coming to sunny California. I thought I'd try to give y'all a slice of life for what a cardiologist is like in the Bronx. And so I was on service a couple of weeks ago, and that means we round in the hospital and see patients. And so I thought, I'm going to count how many patients I see that day in the hospital, and then I'm going to count how many of them have a disease that may have been preventable with a plant-based diet. And I said, okay, I'll look at diabetes, high blood pressure, high cholesterol, and coronary artery disease. So that day, I saw 20 patients in the hospital, and not 12, not 15, but all 20 of them had a disease that could have been preventable with a plant-based diet. And so then the very next day, I rounded on a 24-year-old who came in with a heart attack. He had no uncommon condition that would predispose him to that. There were no drugs involved. This is a garden variety heart attack. We have a very serious problem here in the Western world. Okay, so how common is heart disease? It is obscenely common. What is the cause? Some of these slides may look familiar. Oh yes, so we need to look to where heart disease isn't to start to get some clues about why it isn't there. So, Dr. Campbell did, of course, some amazing work in rural China, and he found that populations there, especially in the more rural areas that had essentially a plant-based diet, they had extremely low rates of disease. And the more animal products they ate, the more disease they had. And that kind of finding is evident throughout the globe. But if we move someone from those kind of plant-based societies, more easternized societies, to the Western world, to the US, we will ruin them within a generation or two. That's not evolution. That takes millions of years. That's lifestyle. And I would say largely the toxic Western diet. And there's a really interesting study from South Africa that was published in 1974. And what they did there is they looked at heart disease rates in South Africa, among other diseases, and throughout the globe. And they specifically compared South African whites and the South African American population. Now, the South African white population around that time, they ate a Western diet, typical Western diet, and had among the highest rates of heart disease in the world. And when they looked at other Western populations, similar theme. Western diet, lots of heart disease. But then they looked at the African American population in South Africa. They live right next to the whites. But that African American population ate largely a plant-based diet. So these investigators looked at the medical records of a hospital in Johannesburg over 10 years. And each year, about 40,000 of the African American patients would get admitted there. 40,000. That's 400,000 over 10 years. And they found 30 cases of heart disease over 10 years, and that largely plant-based African American population. I could take you to the cardiac wing of Montefiore right now, and we would see more than 30 cases of heart disease. And they also found that when they looked at other Eastern populations throughout the globe, they found the same sort of thing. And of course, closer to home in Framingham, Massachusetts, the famous Framingham Heart Study, where they put the whole theme of risk factors on the map. They followed thousands of patients there for years and years. And the former director of the Framingham Heart Study, Dr. Bill Castelli, has said that over the first 50 years of the Framingham Heart Study, in people with total cholesterol levels less than 150, they saw only 5 heart attacks over 50 years. So when Jeff asked me earlier to comment on the cholesterol level, that's exactly what came to mind, the 150 from Framingham. Right, so you've seen this picture before, but these kinds of things bear reinforcing. This is courtesy of Dr. Klatt and Dr. Esselstyn. This is, of course, a normal artery, and it's been discussed, this brown line here is, of course, the endothelial cell. You want to treat that well. The endothelial cell is your friend, and cardiologists like to say, you are as young as your endothelium. Because we think we're funny. But you know, if I took all of the endothelial cells out of Jeff and I laid them on the ground, I would fill up about 7 tennis courts. 7 tennis courts worth of endothelial cells. So you want to treat them well. And this, of course, is a highly diseased artery with a teeny weeny opening for the blood to flow through. Some of you may know people that go for a walk, then they have to stop, they get chest pressure, a pill under the tongue, they wait a second, then they can do it again, and it just keeps repeating and repeating itself. This is what they have. They have this kind of stable, socked-in, blocked coronary artery. But of course, as discussed, this is not the kind that typically causes a heart attack. It's the smaller lesions here, and I want to reinforce this point. So this is, of course, the center of the artery where the blood flows. This is the wall of the artery. And these little yellow dots are cholesterol particles. So the endothelial cell can become damaged. Now, whether that's through smoking, toxic Western diet, pollution, whatever that might be, that starts the atherosclerotic process. And when that happens, those little cholesterol particles can burrow into the wall of the blood vessel, exactly where you don't want them. And it's kind of like a splinter. When you get a splinter, it's all red and inflamed and irritated and painful. Well, that's the same kind of thing, but it's happening in the wall of your blood vessel. And it's a whole milieu of inflammatory cells and oxidation and more cholesterol, and it weakens your endothelial cells, and it makes your artery less healthy every second of every day. And all of that, all of those enzymes and the oxidative stress slowly weaken the fibrous cap over time till it becomes thinner and thinner. And as the blood rushes by it, one random Tuesday afternoon, that fibrous cap cracks. And all that cholesterol grummus gets exposed to the blood here. Now, if I cut myself, I'll make a clot and I'll stop bleeding, and that's good. It's good that I get a clot there, otherwise I'd bleed to death. But you don't want a clot here. And when this cholesterol grummus gets exposed to the blood, it makes the blood clot. Boom, suddenly it can clot off the whole artery, no blood flow to the heart, part of the heart muscle dies, that's a heart attack. Now you may have seen these medical drama shows, ER, and when someone rushes in, oh my God, they have a big heart attack, we gotta rush them to the catheterization laboratory right away. This is what's happening. They have a clot in their artery, and when that happens, you want a stent. You want a stent if that happens. But we, of course, want to prevent that. This is a histologic picture of what we just saw. This is a coronary artery. The blood flows here in the center. Tons of cholesterol grummus in the artery. And then this fibrous cap cracked. Boom, blood clot. This patient did not survive. This is a picture of the heart. This is a coronary artery, one of the blood vessels that feeds the heart with blood. This is a clot in the artery. This person had a heart attack and clearly did not survive. Oh yes. So I wanted to show you guys, if you survive your heart attack, which many do, but unfortunately many do not, what the heart can look like. Now this is an ultrasound picture of the heart. And you may have heard of ultrasound pictures of the baby. This is an ultrasound picture of your heart. And many of you may have had one of those. And what I want to draw your attention to is this portion of the heart here. This is the left ventricle, the part of the heart that pumps blood to the body, and the part of the heart that is typically affected by a heart attack. Now, if you look here, you can see this whole wall, it's all moving in well. This is normal. This is a heart that is squeezing normally. This is what we want. This, however, is a heart after a big heart attack. This heart is not squeezing normally. You can see these parts of the walls are moving here, but all along the top 2/3 of the heart, not moving at all. This is what a heart attack may look like if you survive it. And when I was in the echo lab, I read these pictures as part of my job. I'm like, I want to get one of these for the talk. And it took me about 4 minutes to find one, because unfortunately heart disease is obscenely common. So, oh yes, this is great, relatively new stuff about eating animal products. So can eating red meat make you dead meat? And so of course the answer is yes. And this is a really awesome, relatively new study, about 1.5 years old, where they took people who are omnivores, eat everything, and they took people who are self-described vegans for 1 year, and they fed them a steak. And when they fed the omnivores a steak, they ultimately made something called TMAO, or trimethylamine oxide. And who cares? Well, your body cares. TMAO is not your friend. TMAO may raise cholesterol levels a little bit, and it can promote and help cholesterol deposit in the wall of your artery exactly where you don't want it. And we know that the higher your TMAO level in your blood, the worse your heart outcomes are. But yet, when they fed the self-described vegans a steak, they made virtually no TMAO. What's going on? Well, what's going on is our gut bacteria. That's what's going on. We each have about 1 trillion gut bacteria. Maybe there are about 150 people here. So, there are about 150 trillion gut bacteria hanging out with us right now. And when you eat a plant-based diet, you select for slightly different gut bacteria than if you eat animal products. And it's that difference that accounts for the difference in formation of TMAO. But so why in the world did they think to look at steak and L-carnitine? Well, it's because it's structurally similar to choline. Who cares? Well, choline is in fish. Choline is in chicken. Choline is in dairy. So when you eat those things, you also make toxic TMAO. But you know what? We need choline. Choline is a required nutrient, but it's in plants, and you can get it when you eat plants. But wait a second, Dr. Ostfeld, you just said that when you eat choline, you're going to make TMAO. That's true, but it depends where you get it. When you get it from plants, you don't select for the gut bacteria that lead to the formation of TMAO. So it's as if eating plants creates a coat of armor in your stomach protecting you and letting you get the choline. But it's good to stay tuned. Oh yes, and so some of my patients then ask me, well, I've been eating plants for a while, so does that mean I can go back to eating steaks for a bit and I don't have to worry about this? Well, of course the answer is no. Because obviously there's lots of other bad things about animal products, but specifically when it comes to TMAO, your gut bacteria shift very quickly. In only a day or two, if you start eating animal products, it'll go back to the unhealthy kind of gut bacteria. So the answer to that patient's question is, of course, no. And stay tuned, because there's a lot going on with the gut biome and its interaction in health. And a very recent study just identified how artificial sweeteners, the stuff that's in Sweet and Low and Splenda, are associated with altering gut bacteria and increasing your risk of diabetes. There's a lot out there with this, and some people have told me once I mentioned that I unfortunately or unwittingly eliminated one of their food groups. So hopefully that hasn't happened to anyone out there. Yes. I need some audience participation again. Can you remind me, what is the circumference of the Earth? You guys are good. 24,000 miles, exactly. The circumference of the Earth is about 24,000 miles. How many miles of blood vessels do we have in our body? All right, I got another 24,000. So we have about 60,000 miles of blood vessels in our body. 60,000. Now, I didn't count it. I got that from the George Washington University cardiology website, so I'll take their word for it. 60,000 miles of blood vessels in our body. So it's no wonder that if we eat healthfully, we will treat every square millimeter of our body healthfully. And we know from the work from Dr. Vogel that even one unhealthy meal can make those arteries stuck. One unhealthy meal. But you know what? It's not even just the arteries, it's the lungs too. One unhealthy meal can worsen lung function and make asthmatics more likely to get admitted. When we eat healthfully, we treat every square millimeter of our body healthfully. So how common is heart disease? It is obscenely common. What is the cause? I would say largely the toxic Western diet, and please don't smoke. How can we prevent and reverse disease? Right, so have we lost? Have we lost already? Because medications don't cure heart disease. Stents, they don't cure heart disease. Bypass surgery doesn't cure heart disease. Have we lost? No, we have not. And healthy living is the best revenge. So let's take a little global tour, or partial global tour. And the first study I want to mention is the EPIC study, the European Prospective Investigation into Cancer and Nutrition. And what they did is they watched a whole bunch of people for a whole bunch of years and looked at what kind of lifestyle measures would increase or decrease the risk of disease. And they followed over 20,000 patients for like 8 years. And so they identified 4 healthy lifestyle factors. That's it, 4 healthy lifestyle factors. And it was not being obese, it was doing regular exercise, it was not smoking, and having a pretty healthy diet. Lots of fruits and vegetables and not too many animal products, okay? So that's how they defined it. And if you did that, your risk of developing a chronic disease like heart disease or cancer fell by about 80%. 80% if you did those 4 things. But unfortunately, only 9% of the population actually did those 4 things. All right, let's jump over to England. This is the Health Surveys for England study. They did the same kind of thing, followed a whole bunch of people for a whole bunch of years, and their national healthcare system makes it a little easier to do these large epidemiologic studies. And so what they looked at is the amount of fruits and vegetables people ate and its impact on risk. And so even up to 7 or more fruits and vegetables a day, lower risk. 7 or more, lower risk. But they couldn't look at more than that because so few people ate more than 7. The whole statistics of it fell apart. Let's jump over to Sweden. And this is the study that Dr. Letterman was just mentioning, and just was published, I think, in JACC. Yeah. So, and same sort of thing. They looked at 20,000 people over 11 years. They looked at those 5 healthy lifestyle measures that he was mentioning. The one, in addition to the one from EPIC, was moderate alcohol intake. And so, in that study, there was about an 80% lower risk of a chronic disease when you did those 5 lifestyle measures, but unfortunately only 1% of the population did it. If we jump to the US, you can find very similar studies finding very similar findings. Now, all of this is great, very interesting research, but it kind of sounds familiar. Now, if we think about the populations that were described in the South African study, Healthy Lifestyle, Less Disease, by Dr. Campbell, Healthy Lifestyle, Less Disease, it all kind of sounds familiar. We have not embraced the lessons yet. Oh yeah, so it kind of got me to thinking then that there is an axis of evil when it comes to health, axis of evil with health. And that of course includes the standard American diet, lack of physical activity, and smoking. That is the lifestyle axis of evil. Plants or burgers, you choose. This is a slide courtesy of one of my colleagues, Dr. D'Alessandro, an excellent surgeon. And I should say, I feel, again, very fortunate to work at Montefiore. Most of them have embraced what we're doing. And the cardiac surgeons now are referring patients to our wellness program, which has been a great, great step. They've taken to it really nicely, so that's awesome. And this is a picture of bypass surgery. This is the patient's face covered with a towel. Feet are over here. This is the chest. This is the heart here. The chest, of course, has been sawed open, literally with a saw. And these are metal retractors prying the heart open, prying the breastbone open. This is the heart. It's been stopped. It's not beating. And of course, they're taking a vein from the leg and an artery from the chest and stitching it back into the heart, bypassing a blockage. And along the lines of what Dr. Esselstyn has said, when I mention to my patients or my colleagues that they should eat kale, sometimes they'll tell me that I'm extreme, that it's sometimes extreme that it can be extreme to eat kale. And when did the world turn upside down? When did it become extreme to eat fruits and vegetables and perfectly normal to saw open someone's chest and take a vein from their leg and stitch it back in? The world's upside down. Yes, so you don't want to bypass surgery, but what about a stent? Now, if you're having a heart attack, you want to have a stent. But in the stable situation, that stable, socked-in blockage, what about then? Well, this is a quote from two very prominent cardiologists. A, quote, stent-first strategy for patients with stable disease gets a less is more designation because there is no known benefit and there are definite harms. This is your health insurance. Hippocrates said, let food be thy medicine, medicine thy food. All right, so one of my patients said, Doc, I did everything they told me to do. Why did I have a heart attack? Well, it's because we have not been telling you the right things to do. So why might that be? This is a great quote. It's a little long, but it's great, from Dr. Stephen DeVries, cardiologist at Northwestern. So he said, it struck me as a peculiar paradox that guidelines highlight, medical guidelines that help us make decisions, guidelines highlight the primary importance of nutrition and lifestyle, yet the physicians who are expected to implement these guidelines receive absolutely no education in these areas during their residency and subspecialty training. Unfortunately, that is true. But those things are changing. There are a variety of medical schools that are starting to implement educational measures along these lines. And at Einstein, the medical school where I work, I have the opportunity to give a preventive cardiology lecture to the whole second year medical student class. And what I talk about is, I didn't say exactly what I was going to talk about to the medical school, but I talk about the impact of a plant-based diet. That is really prevention. So that's been really awesome. Oh yeah, so why do we not hear about this stuff? So you guys remember last year the awesome commercial during the Super Bowl about broccoli? Well, of course you don't, because it never happened. So let's take a look at the advertising dollars that were spent in 2004. You can slice and dice this with data in all kinds of ways. I just picked these from 2004. The top 8 fast food chains spent $2.3 billion on advertising. The federal spending for the 5-a-day program, the program where they wanted you to eat more fruits and vegetables, that's $4.9 million. So let's take a step back and think about those numbers, because it's kind of hard to I had a hard time wrapping my head around that. So if we change the dollars to seconds, 2.3 billion seconds, I hope my math was right on the airplane, that's 73 years. 73 years. 4.9 million seconds, that's 0.16 years. That's like 2 months. 73 years versus 2 months. But you know what? Times are changing. Times are changing, and I'm inspired by Rip's talk last night, and all of the other talks today, and all of you being here, because times are changing. And one of the main reasons why is the work from Dr. Esselstyn, where he encouraged his patients, he's way ahead of his time, in the 80s, long before there were these kinds of conferences, to embrace a whole food, plant-based diet without oil. And these are some of the kinds of foods he would ask them to eat. And as you know, in his original study with 24 patients with severe 3-vessel coronary artery disease. Why do I say 3-vessel? Because there are 3 main blood vessels that feed the heart with blood, and in his study, all the patients had all 3 of those vessels with disease. And he followed them for 12 years. And there were 6 patients, didn't work out, wasn't a fit for them, and those patients, they went back to their cardiologist, they had about 13 events over the 12 years of the study. But in the 17 patients who were fully compliant, over the 12 years, they had no events, no cardiac events. That's pretty awesome. And Dr. Esselstyn described how one person strayed from the flock a little bit. This picture he showed you of the patient who had a heart attack and then 3 years later had a repeat angiogram after embracing a plant-based diet, much better. The reason I wanted to show this is because I wanted to give my perspective as a cardiologist. So I've been a cardiologist about 11 years. I have never seen any medication, any intervention, nothing come close to this kind of change. The only thing is a plant-based diet. So, and again, he has evidence or data now on a much larger group of patients, about 200, of whom about 177 were adherent, about a 90% compliance rate. And of those 177, 112 of them had chest pain, it got better, and 104. 27 of them avoided previously suggested stent and bypass surgery. They were recommended to have those kinds of procedures, but were able to avoid it. That's a lot of cost, that's a lot of morbidity. And patients lost on average about 18 pounds. And of those 177 compliant patients, only one had a recurrent event. That's a 0.6% event rate. And of the 21 non-adherent patients, they had a 62% event rate. 62 versus 0.6. That's kind of subtle. And I wanted to put this in perspective. Dr. Esselstyn's event rate, 0.6%. The Lyon Mediterranean Heart Study of patients post-heart attack had about a 28% event rate. The COURAGE trial, about 19. The PREDIMED study, which is a study of patients with no known heart disease. And they started them either on basically the standard American diet or the Mediterranean-style diet. And not surprisingly, the Mediterranean-style diet did better than the standard American diet. Diet indeed is a continuum. But those in the Mediterranean-style diet with no known heart disease had an event rate of about 3.5%. Dr. Esselstyn's patients who had advanced disease had a 0.6% event rate. That's awesome. And I wanted to take a slightly deeper dive into the COURAGE trial because I think of all of those studies, it's probably most similar to Dr. Esselstyn's work. And now all this is comparing apples and oranges because they're different studies, different patient populations, so it's really just hypothesis generating. But I think COURAGE is most similar. In the COURAGE trial, they took people with known stable coronary disease who were mostly symptomatic, had a large burden of disease, and they randomized them either to medications versus medications plus a stent. And they found, after about 4 years, no difference. No difference in heart attack, no difference in death. The primary outcome was the same. So medications versus medications plus stent, the same. The stent had no additional added value, hence the less is more recommendation in stable disease. So that's what they did in that study. Now, stable disease, I just want to show you this picture so you can have in your mind what stable disease looks like. So let's compare Dr. Esselstyn's study versus COURAGE trial. Again, apples to oranges. But at baseline in Dr. Esselstyn's study, they had a total cholesterol of 137, and through both healthy lifestyle and some on statins, they got down to 137. And COURAGE, they started at a total cholesterol of 174, got down to 141. LDLs both got to about 70 or so. Okay, those are pretty good numbers and pretty comparable numbers. But look at the event rate, 0.6% versus 19%. What is going on? What's the difference? The difference is the lifestyle. And when you eat this way, a whole food plant-based diet, you are literally bathing your body in a panoply of nutrients. And when you can get to these kinds of values on a path that includes a plant-based diet, you are profoundly improving your health above and beyond just getting there with meds. Getting there with a plant-based diet has tons of more benefits for you than just with medications alone. A little bit of a deeper dive. So in Dr. Esselstyn's study, those patients who had chest pain, about 93% of them had improvement. In COURAGE, and half the patients got a stent, they only had improvement in 73%. chest pain. Half of them got a stent. How about preventing procedures? In Dr. Esselstyn's study, there were 27 who had previously planned procedures were able to avoid them. 27. Let's see. So in the COURAGE trial, I didn't for this back of the envelope comparison, I didn't look at the group that got stents because they already had a procedure. So I just looked at the 1,000 or so patients who were randomized to the medication arm. So how many procedures were they able to prevent in COURAGE? No, they didn't prevent any. It went in the opposite direction. 348 of the patients in the medication arm wound up getting a stent or some kind of coronary intervention. What about lifestyle? In Dr. Esselstyn's study, they lost on average 18 pounds. And I spoke to one of the authors of the COURAGE trial, and they said that they tried very, very hard to have people embrace a healthier lifestyle. Very, very hard. Not very hard, but very, very. And despite that, the patients in the COURAGE trial on average gained about 3 pounds. So that's a swing, of 21 pounds. And of course, compliance matters. Compliance matters. This is great work from Dr. Ornish, and he found the more that people embrace a largely plant-based diet, the more shrinkage you get in blockages in the arteries that feed your heart with blood. And there are other studies that show similar kind of theme. So how common is heart disease? It is obscenely common. What is the cause? I would say largely the toxic Western diet. How can we prevent and reverse disease? Through a whole food plant-based diet, and please don't smoke. So what are we doing? What are we doing at Montefiore? With a lot of advice and guidance from Dr. Esselstyn, I started a cardiac wellness program there about 2.5 years ago. And it's been an absolute labor of love. It's completely rejuvenated me as a physician. And you know, the Bronx, it's a largely indigent area, a very underserved area. And when the patients come to see us, they haven't seen the awesome documentary Forks Over Knives. They haven't read the incredible books Engine 2 Diet, Forks Over Knives, Plan, Prevent, and Reverse Heart Disease. When I mention a plant-based diet at first, that might as well be from Mars. So that's often where we're starting from. And one thing I'm really proud of is that we have these 4 to 5 hour sessions on Saturday mornings where we go through living this way in detail, and we're able to do it without charging patients. I'm not reimbursed for those sessions. We fund it all through donations. So I had a chance to look at about 40 patients that we've followed so far, and we've had maybe a couple hundred come through. And I didn't cherry pick these. I just picked the first couple of patients that came to a bunch of sessions in a row, and this is all I had time to analyze. And I just looked at their LDL cholesterol level. And their average age is about 65. These are a little more than half are women. They were followed on average for 7 months. And with our starting point that we talked about, we're able to lower, these are patients who are either on a stable dose of statin or did not have one started in the interim. We're able to lower their LDL cholesterol a little over 20 points on average, and my record is 120 in about 3 months. And I asked that dude who had that lowering if he was bathing in bacon before he started. Oh yeah, so this is an example, one of the cases that I got to see, and I had the chance to present this at the American College of Cardiology meeting last year, which was great. So this is a 60-year-old guy and has a family history of heart disease, and he was starting to get chest pain, and it got to the point where he would have it sometimes at rest or maybe after walking a couple blocks, and he's like, and then he had a stress test, which was positive, and in medical jargon, positive actually means negative. So positive means that it's a bad finding, so it was positive. Or maybe, yes. So anyway, his stress test showed that he had cholesterol blockages in the blood vessels in his heart. So he didn't want any procedures, and he also said, I don't want to take any of those statin medications. No statin medication. Oh, that's cool. You're the boss. Whatever you want to do. And actually, this session was about, they asked me to ask about, my patient doesn't want to take a statin. What can I do? And they're like, are you sure you're okay with that kind of topic? I'm like, yeah, I think so. So Anyway, this is him at his baseline. He's a little overweight, borderline blood pressure, cholesterol is quite high, he's walking 1 to 3 blocks. So he embraces a plant-based diet. Fast forward 3 or 4 months, boom, lost a lot of weight, blood pressure normalized, cholesterol much lower, LDL down about 70 points, and now he can walk a mile. Another year or so, weight still down, blood pressure good, cholesterol still down, the guy's jogging 2 miles. I saw him about 3 weeks ago, he jogs 4 more miles, no limitations at all. And so the question that I frequently get, and Jane Esselstyn described this beautifully in her talk, is what's up with the HDL? Well, all this other stuff is good, but HDL, that went down. That's the good cholesterol. It went down. That's not good. So, well, when you eat a plant-based diet, it is well described that HDL does indeed fall. And HDL is an extremely complicated molecule. And it can be, it's a double-edged sword. Sometimes it can be your friend, and other times it can be your foe. And when you eat a toxic Western diet, it's pro-oxidant. It can promote cholesterol disease. But when you eat a plant-based diet, it becomes your friend, and a much better vacuum cleaner, sucking cholesterol out of the walls of your blood vessels. So when I see this, I'm happy. I think it's a marker of compliance and the patient's doing better. So, but this, I didn't know it, but the Boston Globe was actually at my talk there. And this is a quote from the Boston Globe so they said that cardiologists, some of the cardiologists listening to the case at the conference insisted that the man should have been talked into going on a statin after hearing all that. But again, times are changing. And when I heard this, I was so pumped. There's a guy, Dr. Kim Williams, I think he's been mentioned a couple times here at this talk. He is the incoming president of the American College of Cardiology. That's a very important organization in the world of in the myopic world of cardiology. And he's vegan. He's vegan. And he said, I recommend a plant-based diet because I know it's going to lower his patient's blood pressure, improve their insulin sensitivity, that means improve diabetes, and decrease their cholesterol. I was so pumped. So how common is heart disease? It is obscenely common. What's the cause? Toxic Western diet, and please don't smoke. How can we prevent and reverse disease? A whole food plant-based diet. Don't forget the axis of evil. What are we doing at Montefiore? We have this wellness program that's just been amazing. So beyond the heart, let's go beyond the heart. It's a little scary territory for a cardiologist. So does cholesterol disease just affect the heart? No, it affects the whole body. We have 60,000 miles of blood vessels. If you have this disease somewhere, you have it everywhere. So this is a picture of an aorta, the main blood vessel that runs through the body. Tons of cholesterol grummus. Ah, yes. So the CAL scan. Bear with me because I kind of just thought of this the other day. So we're all familiar with a CAT scan, a radiologic test that can take a picture of you from head to toe. So now imagine instead that there was a scan that could take a picture of ways that a plant-based diet might help with disease. Plant-based diet might help with disease. So that's a CAL scan. So let's do a CAL scan. Let's look at aspects of a plant-based diet that have been associated with diseases that aspects of a plant-based diet have been associated with improving. So we'll start from the top. Here we go. So a lot of us are familiar with the ALS Ice Bucket Challenge. Well, elements of a plant-based diet have been associated with less ALS, less Alzheimer's disease, improved cognitive function in midlife. If you eat healthfully when you're young, you have improved cognitive function in midlife before Alzheimer's may even strike. Less stroke, less depression, improved skin appearance, less acne. And in fact, some investigators have suggested that acne is so closely associated with the toxic Western diet that it's not actually a vestige of teenage angst, but rather your body crying out for help from lack of nutrition. Fewer ear infections, less periodontal disease, less acid reflux, less laryngeal cancer, less lung disease, less lung cancer, less breast cancer, less heart disease, less obesity. About 70% of the US population is obese or overweight. They don't seem to be here. Plant-based conference, shocker. But 70% are obese or overweight. And it's so bad, and the sequelae of that are so serious, that Dr. Carmona, the former Surgeon General, has said that this generation may be the first to live fewer years than its parents. Less high blood pressure. We call high blood pressure the silent killer because you don't feel it, but it can kill you. And if you're an average 55-year-old adult in the US, your lifetime risk of developing high blood pressure is about 90%, 90. That's data from the Framingham Heart Study, and every time I read it, I have to reread it because it's like crazy high. But you know what? When you eat a plant-based diet, you are not an average American. Less inflammation, less diabetes. If you're born today, you have a 1 in 3 chance of having diabetes. If you're born today and Hispanic, you have a 1 in 2 chance of developing diabetes. Less colon cancer, less constipation, improved gut immunity, less prostate cancer, improved sexual function for both men and women. Yep, I see somebody cheering in the back. So I'm not going to get into the mechanism now of the canary in the coal mine with erectile dysfunction because Jane Esselstyn described that so beautifully just before. Improved athletic performance, less osteoporosis, and less arthritis. Now, we have those 60,000 miles of blood vessels, including blood vessels to our lower back. And those blood vessels to our lower back can also get clogged with cholesterol. So sometimes lower back pain may be from cholesterol blockages in the blood vessels to your back. So that is a CALE scan. Right. Now this, I want to dive a little bit more into cancer. This is great work from Dr. Colin Campbell in the China study, Beyond the Heart. So he developed a rat liver model of liver cancers, little rat liver cancers. And then he decided he was going to feed them either a diet of 20% casein or 5% casein. That's the protein in animal's milk. And it's well within the range that a person could eat in any given day. So it's not like these supplement studies or something where they'll give someone more than a person would have in 1,000 lifetimes. This is the range of any given day. So he fed those rats 20% casein diet. Cancers grew. 5% shrunk. Fed them 20%, they grew again. 5% shrunk. He could literally turn on and off the size of cancer just by changing the diet. It's awesome. This is great work. The top part is great work from Dr. Ornish in regard to prostate cancer. And he took about 30 people with early stage prostate cancer. Now we don't know what to do with that group of people. Surgery, watchful waiting, we don't know. Perfect group to study. So what he did is he biopsied their prostate and then had them have a healthy, very healthy lifestyle for about 3 months, and then biopsied their prostates again. And when he did that, dozens of anti-cancer genes were upregulated in their expression, and hundreds of pro-cancer genes were downregulated. So you can't change your genes, but you can change which ones speak. You can make your healthier genes speak more loudly, and your unhealthy genes speak more softly. It's awesome. And in work from other groups, the food choices that you make today, it's not only good for you right now, but it can change, of course, which genes get expressed. Your healthy genes get expressed more, your unhealthy genes get expressed less. But it doesn't only affect you. This kind of change might be passed on to your kids and might be passed on to your grandkids. Those positive changes to your gene expression may be passed on to your grandkids. It's an awesome responsibility. Right, so this is cool. Cancer is increasing among meat eaters, particularly but on the other hand, it's decreasing a lot, particularly among vegetarians. So this is great new work from, of course, 1907, the New York Times. This is a study of diet and cancer, a relatively recent one. So in agreement with other studies, our findings suggest that a diet in which plant-based nutrition represents the majority of food intake is likely to maximize health benefits in all age groups. Oh yes, this is courtesy of Dr. T. Colin Campbell from the China study. This is nutrients in plant versus animal-based food. What's the difference between what we're eating? What's the difference? So these are per 500 calories. Per 500 calories of plant-based food, equal parts tomatoes, spinach, lima bean, peas, potatoes, versus animal-based food, equal parts beef, pork, chicken, and whole milk. Let's take a look. Cholesterol, plant-based food, there's none. You don't need to eat a drop of cholesterol. Your body makes all it needs. How about protein? Oh my God, my muscles are gonna go away tomorrow. It's the same. What about beta carotene? It's subtle. What about fiber? Your constipation is going to go away. How about iron? Oh my God, I'm going to become anemic tomorrow. Calcium, my bones are going to fall apart. And of course, there are other benefits. Animal agribusiness creates more global warming than all transportation combined, which of course includes cars. There's deforestation issues to support animal agribusiness. So exercise is, of course, a very important part of health. And this is just to remind me to talk about that. We encourage all our patients to exercise. And this is a picture of the Las Vegas Strip. You can see nobody takes the stairs. But that's okay, because I was at the American College of Cardiology meeting. And I'm like, I can't believe this is happening. I have to take this picture. Nobody was taking stairs. That's a meeting for cardiologists. Should you floss? Another pet interest of mine. Yes, the answer to that is yes. There is a link between gum disease and heart disease, gum disease, erectile dysfunction. What am I talking about? Well, when you have inflammation in your gums from gum disease, that seeps into your blood vessels. And that makes your blood vessels function less well. And we know that if you treat the gum disease, you reduce the inflammation in your mouth, in your blood vessels, and improve blood vessel function, improve endothelial function. Now, we don't know if that's going to prevent a heart attack or a stroke, but the way I see it is even if it turns out to have nothing to do about anything with heart disease, it's still good for your teeth, so what's the downside? Right, so some people have asked about what I used to look like in college. This is, of course, Patrick Baboumian, the strongest man in the world. And how did he get this title? He got this title by lifting about 1,200 pounds and carrying it 10 meters. So he essentially carried a Chevy down the street. And he is plant-based. President Clinton, we all know, had some issues with his heart. And he went plant-based, or vegan, and he lost 24 pounds, and quote, I also have, believe it or not, more energy. Carl Lewis had his, quote, best performance, the gold medal winning Olympic athlete, at 30 years of age as a vegan. This is a great quote. Today, no one can deny the possibility of adequate nutrition and the prolonged maintenance of health and vigor on a vegetarian diet. That's from the Journal of the American Medical Association in 1912. We have not yet embraced the lessons, and this is before the term vegan was even coined. Right. This is ridiculous. This is absolutely ridiculous. More doctors smoke Camels than any other cigarette. This is an ad, like look at the red M and D. This used to go in medical journals that doctors would read, but this is ridiculous. But what I'm hoping is that the conversation that we're having now in a generation or two will also be considered ridiculous, because we will know that eating this way is the best way to promote the health of our environment. So I'm hoping that this lecture will be ridiculous pretty soon. Okay, so how common is heart disease? Obscenely common. What is the cause? Largely the toxic Western diet, and Please don't smoke. How can we prevent and reverse disease? A whole food plant-based diet. What are we doing at Montefiore? We have our cardiac wellness program there. It's been phenomenal. And beyond the heart, we talked about a variety of things, including the CAL scan. So at the beginning, I asked each of you to make a goal or two and think about how the things we were going to talk about can impact that goal. So now, when you go home, I would like each of you to make those goals happen. And please be an ambassador with us. Each of you has a ton of influence with your friends, your community, and please help them embrace a healthier diet. It doesn't have to be all the way in. Every little bit counts. And please spread the word about our program. We want to help people get as healthy as possible. And just so you know where I'm coming from, I'm not reimbursed for our Saturday morning sessions. So this is our really easy to remember website. Thank you very much, Montefiore. And this is my Twitter, if you want to follow me on Twitter. So thank you very much.